Good afternoon, everyone. We're happy to welcome you to the third webinar that is organized and offered by the UNESCO Chair, Global Health and Education, and the Schools for Health in Europe Network. And the topic today is about strategies for school health promotion during COVID times. And good afternoon to you, good evening to some of you. We hope to have an interesting and relevant webinar about a topic that impacts every school all over the world. And remember, it's only 1.5 years ago the pandemic started, and schools in many countries were closed, created virtual learning opportunities for students, and the reopening of schools, which is taking place right now, is happening in various speeds all over the world in the different countries, and also with different support and guidance on national and local level. The UNESCO Chair, Global Health and Education, did a survey on reopening of schools, which we will share some of the results by Nicola Gray, who is an affiliated researcher. And then the SHE Network did a study on a document on how school health promotion during the COVID-19 can be of importance for teaching and for the well-being and health of children and young people. So welcome. We hope you have a good afternoon or evening or morning. And we will, can you get the next slide, Sylvia? During this webinar, we will invite you as an active audience to ask your questions using the Q&A, which you can see, question and answer, at the bottom of your screen. Also, the chat is open for individual chats, hellos, or whatever. But if you have a question concerning the presentation, please use the Q&A, and we will make sure that our experts of today will give your answer. But also, we will use an additional tool. It's the WOOCLab that we use. WOOCLab is, you can access that via the QR code that you have here, or go to the web page for wooclab.com, or you can even use an SMS to answer that. And we will also use the results of the WOOCLab question during the meeting, and it will follow as you will see it as it goes. So, having said that, I would love to introduce the first speaker to you. The first speaker is Nicola Gray. Nicola Gray, she is an, as we call it, affiliated researcher of the UNESCO Chair, Global Health and Education, and involved in the survey. She is also a senior lecturer at the University of Huddersfield, and we're very happy to have you here, Nicola, to give a little sneak preview of the results of the global survey, the second version that you are actively involved with. And the question we would like to ask you to answer in your presentation is, what are the experiences of education and health professionals around the world concerning the safe reopening of schools? And while you are going to prepare your slides, or you already have done that, I see that, I'm asking the people who are attending to this webinar the WOOCLab question what is your background? Very simple question. And I'm messing up the order already. Sorry, Sylvia. So, a very simple question. What is your background? Because that's information that Nicola would like to use during her presentation. She's curious to see what if your background is from health promotion, from healthcare, from education or other. And the book lab link is also in the chat, so it's very easy to access. And also, we have a second book lab question. So the work for you to do here. The second book lab question is how, on a scale from 1 to 5 stars, would you rate the collaboration between health professionals and education professionals when trying to reopen schools in your area? You could take a bit more time in answering that second question while you're listening to Nicola. And Nicola, I'm happy to give the floor to you.
Thank you, Hof. Okay, I'm not sure whether we have the answer to the first WooCap question before I put up my slides.
Be good to check, Sylvia. Is there already?
We have some answers, so I'll share.
Fantastic.
Results. So we have 3 people with a health promotion background, 2 people from healthcare, 1 from education, and 1 from another field.
Okay, that gives me a good indication as we start, and I'm sure more people will answer that question. So we've got a good mixture, a diverse audience this afternoon with all the sectors that are relevant to this survey already here and represented. Let me share my slides with you. I'm delighted to join you this afternoon from the UK. I hope that you're having a good day, and very pleased to be sharing these first results. I'm going to give you a sneak preview of some early results from the survey, and hopefully that will be exciting and give us some ideas that we can talk about the implications from. So where does this come from? You may remember that in May, June 2020, just as the pandemic was really starting and many schools were closed, that we did a first survey from the chair. And I'm just going to remind us of the main themes that came out of that survey, which was the positive aspect of partnership working at local level between school teams, families, and local authorities. The need to keep children and young people in education to avoid widening inequalities. And sadly, we know that those inequalities have widened. So we're definitely trying to improve the situation. That teachers needed consistent information and the resources and time to implement the guidance about infection control measures when they knew they were going to reopen schools. And that health needed to understand something about the school context and needed to provide some autonomy to teachers to make the guidance feasible to enact. And you can see there, I've put a link to our report and publications around the first survey, and there's more information there about COVID-19. So the aim of both of our surveys has been to form a bridge between the scientific data and the needs of people who are actually trying to implement national guidance. And they are directly affected by the impact of that ongoing pandemic and the surrounding communities. And here we are in September 2021 with a new school year opening up in many countries and still struggling with how we are going to implement these measures. So everything's still relevant today. The objectives of the second survey have been, there are 5 here, as you can see, looking at how education and health professionals cope with this ongoing process and cycle of school reopening, and how they're making sense of the guidance about reopening, looking at the main enablers, barriers, and solutions to help school reopening. And we're going to concentrate on here at intersectoral working in schools. This is a real mission of the chair to look at intersectoral working in schools. And the other thing that the first survey brought out were very few mentions of health professionals' involvement in schools. So that's something in the second survey we've been able to develop. And we're exploring the potential for ongoing and widening inequalities. So today I'm going to talk a little bit about the implementation of the infection control measures in school, about training and about intersectoral working. You can see here what the survey looked like. I hope that you all had a go at the survey, and this is what it would have looked like on a smartphone. You can see the different types of questions that we asked. We were delighted in the second survey that we were able to expand the range of languages available. In the first survey, we had the English and French data sets, and this time we've been able to add Arabic, Spanish, German, Portuguese, and Mandarin. It's really exciting, and we're very grateful to the excellent top-class researchers in different countries who've worked with the chair this time round. And there are going to be some very exciting regional studies and papers that will come out, as well as the global papers. So very exciting for us. And every time that we brought a different language on board, we could see how it brought different countries on board. So I'm hesitant at this moment in time to say anything about the number of responses, because the surveys are just closing at the end of this month. And, you know, there are various different things that you have to do to clean the data to know the final number of responses. But I have checked that we've got valid responses from 77 countries, and you can see there the breadth of the response that we've had from health and education professionals, which has been amazing. And the different larger circles you can see on the map are the regional surveys. So the blue dots represent an amazing Portuguese language effort, and the orange dot is a Mandarin version for China, the yellow a Mandarin version for Taiwan, and you know, and the green brings together the other data sets from the other languages. So we really feel that you know, we're getting a good representation across different world regions. And what can we say about the background of our respondents? Well, for the data that I'll present to you next, I'm going to concentrate on the responses to the English and French language data. And what I just want to show you from this slide is the diversity of the respondents that we've had to each of these language surveys. Great numbers of school teachers, principals, on the education side, lots of university researchers, policymakers, and then you can see good health professional response as well in terms of doctors and nurses and researchers in the health education sectors. There are quite big sections for other. And just to say, in one case, that was a music teacher who moved around different schools and had some really interesting insights about what they were seeing as somebody, you know, exposed to different strategies for enactment. So really pleased with the diversity of the respondents. And again, these are very early data. In fact, these are not September data. So I'd be very grateful if you wouldn't share them or take screenshots of them. But I did want to show you something to show what the emerging early trends are. And this is all about enacting measures in schools and the ease or difficulty of compliance. And we split the section into the professionals' perceptions of student compliance and their own staff compliance. So this was only answered by people who indicated that they worked in schools. So the big messages from this slide are that in the yes column that you can see in the middle there, that wearing masks, social distancing, use of sanitizer is very widespread in the schools that people responded from. Ventilation of classrooms in 3/4 of those cases. Organisational changes, again, just a bit lower. But then what's noticeable is this idea of COVID screening by mass testing of students is not very widespread, so just over 25% of schools. And then if we look at the compliance issue, I think that we can see that wearing a mask and physical distancing is considered hard by both staff and their perception of how their students are coping with it. And things that seem to be easier to implement are, you know, using sanitizer, extra washing, obviously the ventilation of classrooms, because that's done for the students and staff automatically there. So we can see that there definitely are differences in the perceived compliance with measures of staff and of students. Another interesting aspect is that of training. So again, this is just the professionals in schools who answered this question. They were asked about their feelings about the training they had had about different aspects of the pandemic. And you can see the number of people who said yes, that they had enough information and training, that's over on the left-hand side, is relatively low. There are no high percentages in that column. And the different types of training that we asked them about were putting infection control measures in place, explaining measures to students, remote teaching, what to do if infection breaks out, and maintaining well-being for students and staff. And on that particular point of maintaining well-being for students and staff, you can see there that a lot of people answered. Just over half of people said no, they had not had any training about doing that. And yet we know that that's going to be a big issue for everybody in schools. Again, early data. We'd be grateful if you wouldn't share or screenshot that slide. And then we come to intersectoral working. Again, early data, but some interesting trends. We asked the question of everybody, so health and education professionals, of how they would rate the collaboration between health and education professionals when trying to reopen schools in their area. Does that question sound familiar? Of course, you're just answering it as well. So I'd be really interested to see how our results of this question in this meeting might differ from what we saw in the survey. But you can see that the ratings from excellent to no collaboration are very diverse, that there is no clustering around a certain answer. And in fact, the highest figure we see here is 30% responding that they thought it was poor collaboration. The interesting part is then if I separate out from the whole just the people who work in schools, then that figure of no collaboration actually goes up to 21%. So people who are actually working at the front line, more of them thought that there had been no collaboration between health and education than the general group of respondents, which we thought was interesting. And let's get some quotes, because we gave people the opportunity to bring this alive by telling us exactly why they had answered the way that they had to the rating question. And so you can see here on the left-hand side, we had a number of positive comments, saying that these professionals work as a team, reinforcing each other's words, and that there was close collaboration between health professionals and the director of the school grouping in this particular case, so that they could standardize the measures and procedures and adopt them in the face of the outbreaks and cases of COVID that they had among pupils and the adults involved. Other people saying they were always in perfect harmony, with great working empathy and with an exchange of ideas and ways of acting. And this reference to a single goal, keeping school open, face-to-face lessons. And then somebody saying, the last positive comment, that they were already working together in schools before the pandemic, so that communication was naturally quite good. On the negative side, they said, well, we've had no contact with these professionals. And then talking about a weakness in school health that predated the pandemic, but was worsened by the pandemic, saying that, talking about lack of public health support, limited contact, rare visits of nurses to the school. And again, this idea of the capacity of the local workforce. There are no school doctors or school nurses. And I think this must be a teacher, because they go on very sadly to say, the school psychiatrist told me that it was nonsense to be afraid to go back to work. So not much support there for their own health and well-being. Schools making their own choices, little discussion with health staff, and a final comment there on the short supply of local health professionals. So just some of the ideas about why people rated positively and negatively. And so I will halt there for now. I would like to recognise the amazing contribution of the rest of the UNESCO chair team, and also to the collaborators in this consortium that brought the second survey together, that you can see on this slide here, including the Schools for Health for Europe. Thank you very much.
Thank you very much, Nicola, for your clear presentation. You have emphasized that these results are early. Can you give an indication of when results are more concrete, or the first results are more definite? So I think, but I'm of course very prejudiced as a manager of the UNESCO chair here. But when I think these are very relevant for the field, people working in the field. So
It's true, we don't want to wait too long before we can make more concrete results available. We're delighted to have a new member joining our team whose principal role will be to now clean the data now that we're closing the surveys, and to be able to start doing that proper statistical analysis of the final data set. As I said, there'll be regional teams working on their own projects as well. So I have great hopes that we will see more concrete results coming out before the end of this calendar year, definitely, and hopefully as soon as we can to empower people who need them for their work.
And thank you very much. And what are the implications you think of your early results for the strategies now needed in schools? New school years have started in many countries.
Right. Well, I think if we think about the slide that showed the perceived compliance with the measures, I think that we need to be proactive about refreshing students and staff with all the reasons that these are really important and why they're more important than ever with the new variants that we're still seeing that seem to be able to get around some of the vaccines. So it's really important that we come back together as a school and not think that everybody remembers why these things were in place, and make sure that the resources are there for teachers to be able to do their job. And I think that that's really about that autonomy idea for teachers, knowing the school context well. How can they use adaptations so that they get the best results? I think we also need to think about mass testing. It showed that there were very few schools where mass testing was in place of students and staff. And so I think that, again, that is something that perhaps could be important for the new year, and to really harness the power of local professionals this time. And I'd say particularly in the area of maintaining health and well-being. We have been living with the trauma of a pandemic now for over 18 months. And I think that, if health professionals and education professionals can come together and think about how they're going to be kind to themselves, support themselves over the next few months of what could be a very difficult northern winter, for the Northern Hemisphere, then that will be amazing. And the other message that comes through for me is that there will be a temptation to deprioritize health-related subjects. If there's catch-up measures needed and perceived in terms of maths, science, and languages, national languages, but just remembering that health should be woven through all of those subjects and not deprioritized.
Sure. Okay, thank you. And we'll surely come back to this at the end of the webinar. And please do not hesitate, you as a participant to this webinar, to ask your questions in the Q&A. And I would love to ask Sylvia to share the results on our WOOC questions on how do you assess in your situation the collaboration between the health and the education sector. So Sylvia.
Yes, I think you can see it now.
Yes.
So it's right in the middle.
Yes, that's interesting. And again, that suggests that there is a diversity of response there, from no collaboration through to excellent collaboration, and for all the reasons in those excellent quotes from our respondents. Thank you for that. Thank you for your participation.
Okay. So thank you very much. And now we will move on to the next speaker, Veronica Velasco. Veronica, let me check the slide. Yes, Veronica, she is an assistant professor at the Department of Psychology of the University of Milano Bicocca. I'm not sure if I pronounce it right, Veronica, in Italy. Veronica is an active researcher. She's a member of the board of the Schools for Health in Europe Network Foundation, and developed a tool which we think is extremely relevant to share with you. And her talk will be, why is the health promoting school approach relevant during the COVID-19 pandemic, and how can health promoting schools be implemented? And that's my question to you, basically. How can it be implemented? And to you as an audience, We also have a question. So again, we would like you to use the book lab. Since the COVID crisis, health promoting school activities in my country or my region have either stopped completely, have decreased, have continued, have increased, or don't know. These are the options, and the link will be in the chat again for answering the question. And without any further ado, I would love to introduce my dear colleague, Veronica, please.
Thank you, Goof, and greetings to everybody. I will share my screen. I'm very glad to be here. And in the next 10 minutes, I will try to answer to this difficult question. So we know from the literature that the pandemic is affecting several aspects of our life and of school life, such as learning, mental health and social well-being, health-related behaviors, safety and home care, inequalities, and work stress. So if we recognize these effects, it's quite evident the importance of consider the global concept of health. So consider the physical health, the psychological health, and the social health. And so for this reason, it's very important to adopt a health promotion approach. And actually, the technically advisory group convened by the WHO for schooling during COVID-19 affirms that the principles of health promoting school are more important in a pandemic. And I think that it is a very, very important statement. I think we all were very glad when we read this statement in the document, but the two questions are still open. Why is it important, and how school can implement this approach during the pandemic? So if we compare the evidence we have about the health promoting school approach and about the school health promotion with the actual situation, we can say that this approach can contribute in promoting regulation and vaccination adherence, learning, physical, mental, and social health among both students and school staff, can contribute in preventing non-communicable disease that have proven to be also very related with the virus infections, and reduce inequality and promote resilience. So I think that looking at the evidence, we can all share the idea that this approach is really very important also during the pandemic. But the question, how can we implement this approach, how school can implement this approach, is still open. And that's why the School for Health in Europe Foundation decided to write a document about this topic and asked me to write it. And you can find the document on the SHE website. You can find the link in the slide and also in the webinar webpage. And the document summarizes evidence about the effects of pandemic on schooling. It presents the health promoting school approach relevance during the pandemic, but most of all, it presents implementation strategies and practical examples from different European countries that can be implemented during the COVID-19 pandemic. I suppose that most of you are familiar with the health promoting school approach, but I would like to summarize just some key elements. This approach acknowledges that learning and healthcare are firmly linked, and it aims for individual and organizational change because it recognizes that all aspects of school can impact on student health. And one of the key elements of this approach is the whole school approach that identifies 6 components that are related with individual elements, like, for example, individual health skill and induction competencies, but also to the social environment, the physical environment, the school policies, and the community links and health services. So in the document, you will find some strategies for each of these components and some examples from each of these components. Of course, now I don't have the time to go in depth to all strategies, but I will give you only some examples. So if we think about the school policies, we have to acknowledge that schools in the last 2 years have to change everything. They first had to close, and so starting with the distant teaching and distant learning, so they have to change all the organization. Then the students come back to school, and so they have to change again and to maintain a physical distance and cleaning procedures and hand washing and so on. And so several new policies and new procedures and new rules had to be followed. And of course, it's very important to define this kind of policies to prevent the virus spread, but it's also important to define other policies related to other health issues, like, for example, distant teaching and cyberbullying. But I think that, of course, the content of these policies are important, but the most important thing is the process to develop and implement these policies. We need to activate participatory process involving students, parents, and school staff in developing these policies and also in the implementation of these policies. We need to consider student perspective about the policies and their needs when we develop these policies. The second component I would like to focus on is the school physical environment. Again, of course, school organization has changed a lot, but the schools need to assure space and time for healthy habits. So for healthy diet, physical activity, active and cooperative learning, sociability. And we know how hard it was in the last 1.5 years to assure space and time for this kind of activities. But in the document, you will find some examples, for example, about physical activities, starting from some strategy used by some countries, like, for example, in Wales, or by some evidence-based program, like Finish School in the Move program or Daily Mind program, that adapted their activities and their tools to promote physical activity, both at a distance where schools were closed and in presence when everybody came back to school, but they have to respect the physical distance. But you will find also another example related to community links from Lithuania, because they made a lot of efforts to use all spaces in the school, but also outside the school, so community spaces, to promote physical activity or just to implement other school activities. So the idea that we have to use several kind of spaces and to link with the community around the school. And the third and last example is about individual health skills and action competencies. We know from the literature that schools have to promote health literacy among students, teachers, and school principals, and promote life skills and action competencies to cope with the pandemic, to cope with the change, to process what is happening, and to be able to experience positive behaviors and positive situations also during the pandemic. And in the document, you will find an example from Italy, where I come from. And we adapted 2 programs based on life skill education to give some strategies and tools to teachers to try with their students to promote life skills and to give them the skills to cope with the situation both during the lockdown and when they come back to school. So in conclusion, what we saw is that the health promoting school approach is relevant but also feasible during the COVID-19 pandemic. it offers an educational vision that, of course, recognizes the importance of the virus prevention, the virus spread prevention, but also affirm the principle of equity, quality, well-being, health, and safety. And it includes several strategies and action that can be adapted to the current situation. And what we saw is also that intersectoral collaboration and networks are essential to guarantee the implementation of this approach. And also this approach can be used also to answer to many of the barriers that Nicola presented before about, for example, the adherence of some limitation of some procedures. So that's it for the moment, and I thank you and remember you that you can find the document on the SHE website.
And your email contact is also in your presentation, yes. Right? Thank you. Thank you very much, Veronica, for your excellent presentation. And it seems that the document that you developed is very timely. Of course, we will talk about that in the next part of our webinar, and I'm just checking with Sylvia if we got any questions from you, audience. Well, there's a comment I see from Marije van Koperen from the Netherlands. Most difficult is to change or adapt activities and interventions from offline to online and to keep their effectiveness. What would you say about that, Veronica? Is it something that sounds familiar to you? Or? Please.
Yes, I totally agree. And I think that the key element is to understand how to promote active learning, cooperative learning, experience-based learning also online. Mm-hmm. Because many of the health promotion activities and strategies are based on these methodologies. We know that if you want to promote health, students have to participate, to have positive experience. And so I think that it's the crucial element. Mm. But I think that there are also many literature about this issue and that many teachers have found strategies to do that. For example, we carry on a study about how to do life skill education at a distance. And we collected from expert teachers some strategies that they use using digital tools and several other strategies, and also peer education support or working team at a distance. And I think that they can be used. And the same is, for example, for other programs to promote physical activity. And we collect some experience, and there are many experiences about how to promote physical activities also online.
Mm, yeah. And another question that I have personally, Veronica, is that we know in our societies in general, the more disadvantaged groups in societies are most affected by COVID. Also students in schools who are in disadvantaged positions. Is there any particular attention paid to that in the document? Can you say something about that?
Yes, of course. We know that the pandemic is increasing inequalities. And so I think this is one of the key elements. We have to continue working on that. And many of the strategies we suggested in the document are focused also to this issue. Because of course we know that there are a gap, a device gap, and the use of devices and online access and so on. But there are also many other kinds of inequalities, like for example, learning styles, because online teaching is feasible for some kind of students, but less for others. Mm. And so again, it's important to use a different kind of teaching methodologies, or maybe, for example, to promote social support for students. We are more vulnerable, and many other strategies.
Okay, thank you very much. I would like to continue with the webinar and ask my colleague Sylvia we asked you as an audience about how the COVID crisis has impacted your health promotion activities. And can you share the results, Sylvia, of the book lab question?
Yes, I will share the screen. As you can see, in most countries or regions, the health promotion activities have decreased, and one person answered that they continued.
Okay, thank you. And we will ask the speakers to comment on that in the next and final part of this webinar, which is a question that I will raise to both speakers. The question is, what can we learn to better prepare schools for future epidemics and disasters? And I would subtitle it also, can we better prepare our societies for future epidemics and disasters? But yes, we talk about schools, but of course, the wider context is our societies that seem to be totally overwhelmed by this event. So first of all, Nikki, would you like to comment on that? And then I'll ask Veronica, and then I'll give the floor back to you, audience. So.
Yes, well, I guess the first part of the answer to your question, Hof, is that we have to do this because what is at stake is our future. You know, if we've got schools now that are having difficulty reopening or where these widening inequalities have happened, then that does not bode well for the future of any country. You know, we need our children and youth to be on a good, healthy trajectory for future success. I was very struck by one word in many words, and one particular word in Veronica's presentation of the participation. You know, going forward, the first part of it that I saw was that there wasn't much participation of teachers, arguably, in, you know, thinking about how health measures were going to be implemented in schools. And I think that it's right, and our survey is bringing out the need, as Veronica said, for students and families to be involved in the implementation and you know, the thoughts that we have for the future and the developments that we might do. So it definitely is going to be a full community you know, effort to make sure that we're more resilient for the future. Now, luckily, I don't just have my words to share, because we did ask the question of our survey respondents about how they saw that we could improve intersectoral working for the future. So I'm delighted to be able to share their thoughts with you. And let's have a look at some of the themes in there as well. But these, you know, that they're saying you need to continue collaborative work in problem situations outside the current pandemic. You know, so if you've managed to bring some teams together now, you've managed to get people focused, let's not lose that. We need to create a health service of national education was the suggestion from one country. So we've got school doctors, school nurses, psychologists, and making the point that, you know, up until now, they've all worked on different missions in different places and with different money. And then others have said, well, you should give resources to school health, creating posts and training these people in health promotion. And the bottom quote on the left-hand side there is, I have come to the conclusion that the only way is to bring people physically together. You know, that is our culture in that country. It is all about who you know. So rules and guidance will not work, but leadership from school principals is crucial. So, you know, it's having people physically present together rather than being dispersed over an area. Another theme coming through strongly for more training, teaching and non-teaching staff by health professionals to really cement that knowledge. And if you think back to what we found about the training in the survey, you know, there's a thirst for more training. Many people felt that they hadn't been properly briefed about even what the impacts of the pandemic would be on education. And, you know, thinking here again, you know, not only in times of pandemic in the next quotes, but we need to be educating students, lectures, videos, didactic games in collaboration with teachers, you know, to prepare ourselves properly. The next quote saying about including parents and guardians in well-structured actions to promote school health. And then the last one on the bottom right for me, I like the phrasing at the end of it. You know, it's joint meetings and decisions, better knowledge of each other, and decompartmentalization around a common objective. Let's stop working in health and education silos. So my 3 themes out of that are leadership on the left, that it must be done not only in times of crisis, we prepare times out of crisis, working together, and that it is this decompartmentalization around a common objective.
Okay, thank you very much. Veronica, would you like to give your view on the better preparation of schools?
Yes, thank you. I think I will come back to some of the comments Nicola just told us. Just a premise. I think that we have to remember, and the question asked before is related to that, the schools never close, because we speak about the school closure, but actually they continue teaching, the teachers continue teaching at a distance. And so that it's important, because that means that also health promotion has to continue also when schools are theoretically closed. And I will just give some ideas. I think that's, as Nicola says, is very important to reinforce collaborations. And to do that we need to structure organizational arrangements to guarantee and reinforce the collaboration between educational and health sectors, community links, collaboration and strategy sharing between schools. So that means that we need networks of schools where both educational and health sector can participate. And there is like a structure collaboration, because we saw that in the country that's where that was present before the pandemic, things work better and they were more able to adapt the activities during the pandemic. And the second thing, we already spoke about it, is participation. We knew that from the literature that participation is very important, but during the pandemic, we saw it in practice, because we saw that students and teachers and parents need to participate to promote their well-being, to maintain a link, a belonging with schools. And so we have to promote co-creation process with school community members and reinforce social links and give school members the opportunity to define and change their context. And the third thing is that I think that health promotion programs are resources for school. We saw several examples of that, such as Daily Mile or Funny School in the Move or Life Skill Training or Unplugged. They are all theory-based and evidence-based programs, and they very well-defined structures give the opportunity to adapt them. And they were able to create tools and material for many schools during the pandemic. And they are also quite a challenging program. And so in the past, they were able to activate capacity building process involving several people in school and outside schools. And these skills developed allow now the people to adapt the practice. And so I think we should work more in this area. And the last thing is the school principal role. If we look at the strategies described in the document, we can see that most of the strategy depend on the school principal, because then depend on the school principal leadership, as Nicola just said, on the school organization, on collaboration and participation, on community health services link. So that means that we need to focus more on school principal role and to find the new strategies to support them. And that's it. Thank you.
Okay, thank you very much. And very interestingly, how your what you presented is very in line with some of the results that Nicola shared from the survey. So there's an apparent need for leadership. I mean, that's a word in full letters: better collaboration, stop working in silos, and participation. And yeah, the time, I think, is helping us in getting health and education together in order for better education for every child. And actually, we got two comments, one in the chat from Dr. Inon Schenker, saying, first of all, referring to the new international health promoting school standards and guidelines that give good guidance for health education sector's collaboration. And the challenge is deeper: how to address the immediate COVID prevention and vaccination issues, and at the same time not forget the NCDs, the HIV, the bullying. And also Inon Schenker mentions, that in Jerusalem they had to rethink parents' participation, as their influence on content and policy is dramatic during the COVID-19 crisis. And maybe, Nikki, you can comment on that, and Veronica. Nikki?
Well, certainly, I think what that's very thoughtful comment brings out is that whilst we have a pandemic, it's lying on top of everything else. And I know that we've talked about in the past in our webinars, we've talked about the syndemic as opposed to the pandemic, where we recognise that COVID is one part of it, but there is also an information part of it. There's also the NCDs. These factors that are very closely linked to COVID and don't go away because we've got a new threat. And it is worrying, some of the things that the commentaries that we've done around COVID-19, we did one particularly on the situation of children and youth with NCDs in schools, because early conversations with other members of the community were that they were perhaps going to be kept away from school because, pre-existing conditions could put them more at risk. And also, that actually some families had found that it was easier to cope with life when children were out of school and being homeschooled. But there's an impact that has on those young people, with a long-term condition of not being socialised with the peers and not being in school. And so I think that as we start a return to school, again, for the new school year, that we need to keep all these factors, they all are like plates in the air being juggled. And we need to make sure that we don't neglect something because of the more present threat of infection.
Sure. And Veronica, how would you comment on this, please?
Yeah, I totally agree. And I think we should remember also that we shouldn't divide also the health issues, because the people are the same. We all have a unique lifestyle. And so we don't have to think the single issue separately from each other, but we have to focus on the lifestyle of a person. And also, if we come back to the theories, we can see that the determinant of a health behavior are the same of another behavior. So if we work on some determinants, we will work on both vaccination, but also on bullying or on sexual behavior and so on. So for example, if we work on school connectedness, we know that this is protective factor for all kind of health behaviors. And it will be also a good reason to vaccinate, to adhere to the vaccination. And the same is to participation, for example, or for health literacy and so on. So I think that if we focus on some determinants that are very important, we can transfer the learning from one health area to another, and not consider, okay, now I work on vaccination, but I forget all the other areas. But I work to a healthy life, a healthy lifestyle, and vaccination should be a part of this.
Yeah.
And of course, responsibility.
Sorry, what did you say?
and also of co-responsibility. So only not my health, but the health of everybody. So it's like to connect the several activities and ideas and strategies.
Yeah. Well, another comment from one of the participants is that they did a small survey in the Netherlands. Maybe you read it, among developers of health promotion interventions and health promotion workers from the regional health services. And they found that their work basically stood still during COVID. They were not allowed in schools because schools had other organizational issues to do, and health promotion of lifestyles in students was not relevant anymore. Is that recognizable?
Yes,
Veronica?
I think so. But I think that's also now the relation between health and learning is emerging, and everyone is seeing how mental health, for example, is related with learning. And so what the pandemic start very surprisingly, and so nobody knew what to do. But now I think we can sensibilize about the link between learning and health. And so let them understand that if you work about health and you are doing health promotion, you are also promoting learning. And so it's not something that you have to add to the school mission, but it's the same thing.
Yeah. And there's also a comment from another participant, Peter Paulus, saying there are also positive impacts on the change of society in general, where health could also play a new role. I mean, we talk very much about the problems caused by the pandemic, but there are also new chances, new possibilities. And how would that impact the work on promoting health in schools? Nicola, and maybe you also, Veronica, for a comment?
Yes, I've been reflecting on what has come out of this that is positive. And I think that sad though it is, the fact that the pandemic has laid bare decades of underinvestment in education and in the links between health and education, that, you know, I think now that the publicity around schools and about the impacts on children and youth if schools are not open, in all kinds of ways, including what impact it has on, you know, their nutrition, access to free school meals and things like that, then I think that there has been some good awareness raising among a general population, and maybe some priorities have increased for governments. I think that many governments now recognise that it is, you know, that schools should stay open as much as possible. And we certainly saw that in the UK, that they were prioritised over other settings. So that was positive. Also on the point of the lives of children at school who have NCDs, you know, the fact that we saw this rapid development of remote learning opportunities and these kind of hybrid platforms, coupled with telemedicine, might mean that those children in the future who are known not to have as high an educational aspiration as other children who do not have NCDs, then maybe there's a way forward there that we can harness telemedicine and that, so that they don't miss so many days of school, for example, and that they can keep up with their peers and have higher vocational aspirations. So those are a couple of the positive things that we've seen coming out of the pandemic. The profile is raised.
Yeah, thank you. And Veronica, would you like to have a short comment on that?
Yes, I agree with what I was saying before, that now there is more awareness about the link between health and education, and all kinds of education, I think, because also, for example, physical activity that in many countries was not so promoted by school. Now, I think that teachers realize how important it is for students to their well-being, or will more able to learn better. So I think that it's a good effect of the situation, and we should work on that.
Okay, thank you. It's also confirmed by Marije van Koperen from the Netherlands that there is more focus now on the well-being of students than probably before COVID was there. Okay, I want to thank you, Nicola Gray and Veronica Velasco, for your contribution to this webinar, because we are at the end. It's 3 o'clock here local time. I want to thank all the participants to this event at our meeting. We also had some participants who joined us on YouTube. We will make a web page on the website of UNESCO Chair and on the SHE Network with the presentations, with the videos, and with relevant resources and the results of the book labs that you can find and look at afterwards. So thank you very much, and have a good day.